Hi there, my name is Ashley Rosko. I am a professor in the Division of Hematology at The Ohio State University, and I'm the medical director of the Oncogeriatric program. At the American Society of Hematology, I presented on Lovesick, which is about couples' health before and after autologous stem cell transplant for patients and partners of those who have multiple myeloma. So our study focused on the physical health and mental health and the couple's health for patients who are diagnosed with multiple myeloma. So in our study, and this is a preliminary analysis in which we explored dyads, which is both the patient and a partner, to be able to better identify the trajectories of health before and after stem cell transplant. So importantly, in our study, what we identified in our preliminary analysis is that we are exploring patients' mental health, physical health, and couple satisfaction during that period of time. So what we identified initially is that we know that during the course of transplant, we know that age also can impact couples' health as well. And so we found that with before and after transplant, age adversely impact functional status during transplant. We also identified for patients who had a strong couple satisfaction that was associated with improved depression scores and improved overall quality of life. We also found that in couple satisfaction that was associated with improved physical function for patients diagnosed with multiple myeloma. So these are important aspects of health, to not only to be able to identify the trajectories of patients, but also to identify the trajectories of their partners and how that can influence one another and how we can capitalize on a strong bond between a patient and a partner to be able to improve outcomes for patients with multiple myeloma. So importantly, when an individual is diagnosed with a malignancy, it has this rippling effect where it not only impacts the patient, but it impacts the caregivers, it can impact the partner. And so we want to be able to better identify and dissect that. What we did identify for patients that it can be discordant in terms of how different things it can impact patients. We found, for example, that distress for the patient significantly impacted their frailty, but distress for the partner did not. So that's an example of how we can be able to better dissect health factors and also mental health factors in terms of being able to identify them and improve upon them for transplant physicians. Over a decade ago, it was identified for people who have social support, in particular spousal support, that improved cancer outcomes when it came to the diagnosis and treatment and long-term outcomes for patients diagnosed with multiple myeloma. And that data has been published and reproduced many different times. But having a spouse in it itself is not necessarily protective. It's really the strength of that relationship. If there's a strong, supportive relationship, that can be really impactful for a patient who's diagnosed with multiple myeloma. In our analysis, we were able to study different types of physical health, mental health, and psychosocial support using self-reported tools, validated instruments to not only explore things like depression, but also loneliness, to be able to explore things like couple satisfaction, couple strain, and there are different types of instruments we use to be able to measure those. In partnership with our team with the Institute for Behavioral Medicine Research at Ohio State, we're able to synergize our work in multiple myeloma with that in psychology. So what would an ideal survivorship program look like for patients diagnosed with multiple myeloma? And currently, survivorship starts at the time of diagnosis. And what we identified in our data is being able to identify if there is couple strain, having support services, whether that's through psychosocial oncology, through couples counseling, may be very beneficial to be able to improve the overall trajectories of patients diagnosed with myeloma. So importantly, when we talk about psychosocial support, that can mean many different things. That may need to be, patient counseling. It could need to be partners counseling, and then also couples counseling. And that varies about the services that are available from institution to institution. But identifying those factors early, I think, are really what's important. And what we identified in our data set is that these are patients who are newly diagnosed, and we kind of ask questions about their caregiver, but it's oftentimes been outside of the scope of the treating physician to be able to get a better sense of how that partnership is functioning. But I think what we've really identified is that merely identifying a caregiver, merely identifying a partner that can help support them is probably not enough, and being able to identify the strength of that relationship. And if there is strain, which it often is in the time when someone's diagnosed with a cancer, to be able to put those support services in place sooner. In the previous literature in our data sets too, we've identified that patients' partners have experienced even higher anxiety, higher depression than the patient themselves. And that is important for us to be able to recognize, like, why would that be? Well, like as I mentioned, having a diagnosis of cancer has this ripple effect. And also it's a time of vulnerability in terms of not having control, inability to be able to help, inability to be able to provide ongoing support in the ways that sometimes patients need. And that can be a very stressful period of time. And so oftentimes, patients or partners may be focused on the kind of the medical care, but not really realizing that the mental health care is equally as important. An important part about what we're looking at is this idea of this marital contagion, is that just similar to emotional contagion, where there can be kind of unconscious behaviors that are elicited, what we identify in a married couple too, there can be physical health changes that can also be shared. And so we may, if someone is getting sicker, we don't necessarily know yet, but we're trying to explore how that, if someone's becoming more frail, how that impacts the partner as well. Because again, that's in the past really been outside of the scope of the treating physician. But we are seeing these mirroring behaviors when it comes to things like body mass index, when we're looking at things like emotional support, and our larger data set, we're hoping to be able to identify how these mirroring behaviors when it comes to frailty can be capitalized on, or whether or not, so if a partner is stronger physically, whether or not we can encourage, for the patient and the partner to work together on some of their physical health as well as some of their mental health. Importantly, our data is in our preliminary analysis, but what we're looking forward to is being able to look at the trajectories over time. Our data is looking at patients directly before transplant and then 90 days after transplant. But of course, we want to look at the sustainability and of these parameters, whether that's 1 year out or 2 years out, to see how dynamic these influences are for both mental health and physical health behavior change.